So one can say that DNA mutations, how to put this? I mean, if you think about cancer, I would say that all forms of cancers start with a mutation or a DNA damage. That's how they start. We know, so I mean, that's how important this is. And if you don't have repair system that take care of the damages as they occur, the frequency of cancer, for example, becomes much higher. And there are diseases where you have a disturbed repair mechanisms. They don't work as they should. They are themselves mutated, and then you get very high levels of cancer. One example is scleroderma pigmentosum, a disease characterized very carefully by an excellent American scientist. His name is John Cleaver, and he found all these different genes that cause scleroderma pigmentosum. And then it turns out that all these genes actually, most of them actually encode components of the nucleotide excision repair system in human cells. And the people, or the patients suffering from this disease, they cannot repair UV-induced damage as they should, and they get extremely sensitive to sunlight. They need to stay inside, and when they go inside, when they are subjected to UV light, they develop different types of tumors, and they often die from malignant melanoma or this type of skin tumors. So that's the importance of it. But then, of course, a certain level of mutations is also something that's probably needed. So even if the cells try to sort of lower the levels as much as possible, of course, you don't want a frozen genome, because Darwinian evolution requires that there are at least some mutations that take place and that we can utilize for selection.